Okay, good afternoon, everybody. I'm Paul Keeley. I'm the Chief Operating Officer at the National Low-Income Housing Coalition, filling in for Diane Yantel. Want to welcome everybody to this weekly call, Coronavirus, Housing, and Homelessness. We have a lot of people registered for the call, as always. They include people experiencing homelessness, low-income renters, housing and homeless advocates, homeless services providers, housing providers, foundation partners, legislative staff, and others. And I want to welcome all of you to today's call. Just a quick update, just a reminder that the National Low-Income Housing Coalition has a wealth of materials on our website. Please be sure to visit our website. The new materials include a new Opportunity Starts at Home poll on COVID-19 housing and homelessness. We talked about it on last week's call. There are new resources available to you there. We got recently updated fact sheets on working with FEMA, on community development block grant, coronavirus funds, on the coronavirus relief fund, with additional examples of recommended uses. And then we know that many of you will submit questions, and you have submitted questions for these calls, and sometimes we don't get to all of them. I will say that a lot of the questions that we do receive are already in a number of fact sheets, and we have 9 frequently asked questions in both English and Spanish on everything from renters' rights to unemployment insurance to rural communities in COVID-19, racial equity in COVID-19, FEMA resources, working to respond to the needs of people with disabilities, homelessness, and more. So please go to our website, check out our FAQs in both English and Spanish when you get a chance. So we have a packed agenda, so I'm not going to waste any more time. I'm going to start with an introduction of Representative Deb Haaland, who is a first-term Congresswoman representing the 1st District of New Mexico. When she and Representative Sharice Davids were elected in 2018, they made history by becoming the first 2 Native American women elected to the United States Congress. Representative Haaland is an enrolled member of the Laguna Pueblo people. In her very short time in Congress, she's already introduced several pieces of housing legislation, including a bill to reauthorize the Native American Housing Assistance and Self-Determination Act, NAHASDA, which provides resources to tribes to ensure that their members can access safe, affordable housing. As a member of the House Armed Services Committee, she has focused her attention on the substandard housing conditions, including mold, infestation, and structural problems that many military service members and their families are forced to live in. Most recently, she endorsed the Emergency Rental Assistance and Rental Market Stabilization Act, which would provide $100 billion in emergency rental assistance to help keep renters stably housed during and after this pandemic. So it's a pleasure for me to turn over the microphone to Representative Haaland. Are you with us, Representative Haaland?
I am. Thank you so much. I hope everyone is doing well today, and I appreciate the opportunity to chat with you all today. Thank you so much. Thank you, Sarah, for inviting me to join your call. It's an honor, and I hope everyone is doing well. Your work is vital to so many people across the country who need rent relief right now. This pandemic has taken more than 115,000 people from us, and the need for us to remain apart prevents us from truly mourning those we have lost. Yet the number of those we have lost does not convey the full impact of this coronavirus. The virus has taken the primary income earner from families and has left some of its survivors with long-term damage. We have had to close massive portions of our economy to keep people safe, but now as we face the final days of increased unemployment benefits and the eviction moratorium, more and more constituents of mine have reached out to my office concerned about keeping a roof over their heads. And I understand what that feels like. So we care deeply about it. Communities around the country are hurting right now, but the president and Senate Republicans have allowed 2 months to pass without providing more support to those in need. Last month, I joined congressional Democrats to pass the HEROES Act. This bill extends unemployment benefits and puts money directly into people's pockets so they can still afford essentials. And of course, of great importance, and with the help of the National Low-Income Housing Coalition, the HEROES Act included a nationwide 12-month moratorium on evictions and foreclosures for all renters and homeowners, along with hundreds of millions of dollars in new rental and mortgage assistance. After passing the HEROES Act, I hosted a telephone town hall focused on bringing help directly to my constituents. I connected them with state officials to help guide them to the resources currently available to them, but people need more aid. In addition to the HEROES Act, I'm proud to be a co-sponsor of the Emergency Rental Assistance and Rental Market Stabilization Act to provide $100 billion in emergency rental assistance to renters in need. It is vital that the next coronavirus package include these funds. I also joined Representative Chuy Garcia from Chicago as a co-sponsor of the Protecting Renters from Evictions and Fees Act, which includes the eviction moratorium included in the HEROES Act, but it adds an important prohibition on the charging of fees or evictions for non-payment of rent during this crisis. My constituents have faced 3 months of rent during this crisis, and they're reaching out worried about the coming evictions if we all fail to act. My district celebrates its diversity, and it is proudly majority minority, but almost twice as many Black and Latino renters have put off paying rent than their white colleagues. Even before the coronavirus reached our state, New Mexico saw one of the most rapid increases in people experiencing homelessness. I'm doing everything in my power to reverse this trend, which is even more dangerous during a public health crisis. We cannot allow even one more person to become vulnerable to this disease due to hardship outside of their control. People experiencing homelessness are at a particular risk during this pandemic because of the lack of stability and basic health benefits that come from shelter that too many of us take for granted. In New Mexico, shelters have struggled to obtain motel vouchers for older individuals and those with underlying health conditions that cannot risk being close to too many other people. Homeless shelters that rely on private donations face an additional threat due to the economic hardship millions of Americans have faced over these last months. Many shelters have seen a decrease in donations, and they're struggling to obtain the sanitary and cleaning supplies necessary to ensure safety for people in need. Unfortunately, coronavirus has disproportionately hit Indian country, taking advantage of the failure of the federal government to uphold its trust responsibility. In New Mexico, Native Americans represent more than half of the coronavirus cases and are dying of COVID-19 at rates 19 times that of all other populations combined. We know that housing conditions have a direct effect on health outcomes, and poor housing conditions have played a role in spreading the virus through Indian country. Housing units in Indian country in New Mexico lack complete plumbing at 5 times the state average. They lack complete kitchens at 3 times the state average and are overcrowded at almost 3 times the state average. I have joined Senator Warren to propose legislation to uphold the federal trust responsibility and provide funds to help address housing and healthcare in Indian country, but we need help now. I work tirelessly to include funding for tribal nations in all the coronavirus packages that have been passed so far, but this administration has failed to release millions of dollars, hundreds of millions of dollars to tribes. As states continue to open up, we must double down on advocating for those in need and make sure our solutions address long-standing systemic racism. The coronavirus has not disappeared, and the financial crisis for millions of people has only just begun. I'm thankful for NLIHC and all of the work all of you do every single day to help keep the focus on those in need, and just know that we are here to help wherever we can. And thank you so much again for having me.
Thank you, Representative Haaland, for those words and for your leadership on this issue. If you have a few minutes for some questions, we'd like to follow up if we could.
Okay, I can, yeah.
Okay, you just let us know if you have to take off. Let us know. But you talked about the incredible statistic that half of the COVID cases in New Mexico are with Native people, and the evidence is pretty stark about how Native people are disproportionately suffering. Can you say more about what are the most pressing challenges? What resources do they need most? And just in general, what are you seeing and hearing from tribal communities?
Sure. Well, I've had opportunities to speak with both Pueblo governors and presidents of the Apache nations and the president of the Navajo Nation. And as you know, the Navajo Nation is the largest geographic reservation or nation, Indian nation in our state. And one of the things that he's always pressed upon are tests, right? I'm not sure if they've gotten the testing situation ironed out yet, but it was taking a very long time to get the results back. And I mean, look, I'll just say this. My daughter got tested this past week, and she was able to get her results by the next day, and she could use her smartphone to check for the results. She could just go online. When we don't have broadband internet service in a lot of our rural communities, including Indian country, it's very difficult for people to be able to get those kinds of services, right? You can have a phone, but if you don't have anything to hook up, no cell phone towers, no internet service, you don't have the same resources as everybody else. So that's an issue that we're working on. I think, and it's shown over and over again that broadband internet service is one of the pressing issues, and it has been for a very long time. So we're working on that as well. But I want to just say a huge thank you to so many of the nonprofit organizations who have stepped up, who have raised money, who have collected items, who have sewn masks, who have delivered food boxes and everything else to the Navajo people on the Navajo Nation and in our Pueblo communities just to help out. And so another issue I just want to say quickly is there's a lot of folks that don't have running water, and that's an issue as well in Indian country. So those are all things that we'd like to work on. I want to, I don't want a whole lot of strings tied to the funding that tribes get, because they need to use theirs for different reasons. Perhaps they'd be better served if they were able to connect, 20 families to the water line instead of, during this pandemic, or if they were able to, get some emergency broadband situated. I want to be supportive of whatever those individual tribes need, and so those are just some of the things that that I've heard of and that we're working on.
Thank you. So we've been hearing a lot about addressing systemic racism in the United States, and you talked about tribal nations having some of the worst housing conditions in America, overcrowding, lack of basic infrastructure. You just talked about water. And this clearly, as you said, is an indication of the continued failure of the United States government to uphold its trust responsibility with tribes. How do you think the pandemic has exposed these structural inequities, and do you think the media and decision makers are becoming more aware in this environment of addressing racial systemic racism and racial inequities, does it make you, do you have any hope? And can you just comment on that in general in terms of what we can do to use this moment to address the needs, the dire needs of people in overcrowded conditions and in communities with lack of infrastructure and so forth?
Right. Well, it's a little difficult to deny, the inequities when you have Indian country with some of the highest rates of positive COVID-19 than anywhere else in the country. It's hard to deny that that they don't have what they need to fight this virus. And yes, all these, the failure for the government to live up to its trust responsibility for decades and decades and decades, it is showing through in every single fabric of what this pandemic has exposed. So yes, we need to keep fighting for these things. And that is legislation that I've been working on since I came to Congress, right? Yes, broadband internet. Yes, running water. Yes, law enforcement. Yes, they need money for their tribal courts and all of the things that keep their communities running. One of the legislative packages I'm working on, it's called the Honoring Promises to Native Nations Act, and that is a response essentially to the 2019 or 2018, I think it was, U.S. Commission on Civil Rights Broken Promises report that essentially outlined five main areas where the federal government is failing its trust responsibility. So the Honoring Promises essentially seeks to address those 5 areas and appropriate the funding that is necessary to bring all those communities up. One of the issues I know too, and if we're speaking about the coronavirus, is overcrowding in houses. There's not enough housing, and that's one of the 5 issues in the Honoring Promises Act. But how over, multi-generations living in one house, that has happened. It's always happened in Indian country. At some point when you have 15 people living in a house, it's going to compromise unless the situation with the virus. So these are all issues that I will continue to work on, as I have been since I was sworn in, and hope we can make some headway in the rest of this term and next term.
Thank you. Representative Haaland, I also want to just thank you for your support of the housing provisions in the HEROES Act, your support of the Emergency Rental Assistance and Rental Market Stabilization Act, people on this call, the National Low-Income Housing Coalition, and all the advocates on this call. We're working very hard to ensure those provisions and the $100 billion in emergency rental assistance are included in any final coronavirus relief package. Mm-hmm. Just a closing question. What advice do you have for us? How can we get this over the finish line?
I appreciate you. We need our allies so much every single day. And I thank you for that kind offer. We, just keep an eye on what we're doing. We need help with everything. We need help with Justice and Policing Act. We need help with the Violence Against Women Act. We need help with the HEROES Act. We need help because all of the legislation that the House has passed in my first term here in Congress, they have been very good pieces of legislation. The Equality Act that ensures that LGBTQ people don't face discrimination when it comes to housing. That's one of the provisions, right? We all need to work together. Nobody should be denied a roof over their head. That is a fundamental, that's a fundamental right, I should say. that we should all have in this country. And so I thank you deeply for all of the work that you are doing. We need to, I know there's so much more work left to do, but we are here to be partners. And I just want to say that if you have ideas for legislation and you feel like, yes, we just need this to happen and, you know, it could help X number of people, let us know about it, because we're always happy, you know, to help out, and you're on the ground, so you know what is needed far more than I do. So we'll listen to you, and we appreciate your support as well.
Representative Haaland, thank you so much. We'll take you up on that offer, and I just really want to thank you for taking the time to be with us today, and especially for your leadership in Congress. So thank you again for joining us. We really, really appreciate your words, and we will keep at it.
Thank you so much.
Thank you. Okay, we will move to the next item on our agenda, and that is Lisa Rice, a good partner of the National Low-Income Housing Coalition, always at the National Fair Housing Alliance, who's going to talk to us a little bit about ensuring federal resources serve all protected classes. Lisa, you there?
Yes, I am. Can you hear me?
I can. Go for it.
Thank you so much. And I first want to say hello to everyone and thank the National Low Income Housing Coalition for inviting me to this critically important discussion. We are really at a pivotal moment in time. And if we don't make the right decisions right now, we could be positioning our nation to be in a much more horrible state than we could have ever imagined. So I do appreciate so much the hard work that the National Low Income Housing Coalition has been doing. You guys have been incredible partners, and I cannot express how much we appreciate your partnership and how deeply grateful we are for all of the work that you do. I also want to thank Congresswoman Haaland for her hard work and her dedication and commitment to these issues, because we have to have champions like her working on Capitol Hill to advance all of the remedies and solutions that we know need to be put in place so that we have true democracy in our nation. You know, COVID-19 really laid bare the inextricable link between health, housing, and race. I think the recent numbers that we are seeing in terms of disparities and who is being impacted by both the pandemic and the economic crisis associated with the pandemic has made it abundantly clear that those three things, housing, health, and race, are inextricably linked. You cannot disassociate one from the other. And that is because both our health and housing systems are impacted by structural racism and inequality that are driving the horrific outcomes that we see and that you just heard Congresswoman Haaland talk about. Residential segregation is really the bedrock and root cause of many of these disparate outcomes. People of color, our communities are deeply segregated. We are more segregated today than we were 100 years ago. Segregation is systemic in our communities. It is the result of centuries of federal and local policies designed to create and perpetuate residential segregation. And that's one of the things that the National Fair Housing Alliance and the National Low Income Housing Coalition have been working so diligently on, and that is formulating policies to reduce residential segregation in America and the harmful impacts of segregation. But segregation really is the bedrock of many of these issues that we're seeing. It drives inequality because in America and the United States, unfortunately, place is linked to opportunity. Okay, and so people of color are more likely to live in toxic environments. They are more likely to live in poorly resourced neighborhoods, and this is irrespective of income. I'm not talking about an issue of class or income or economics. I'm talking about race. People of color are more likely to live in poorly resourced neighborhoods. People of color disproportionately, for example, live in health deserts. In Oakland, California, majority white census tracts have 41 healthcare establishments per every 10,000 people, 11 times greater than the 3.7 health providers found in majority Hispanic census tracts in Oakland. In Atlanta, Georgia, and I like to use this example because many people think of Atlanta as being the Black Mecca. It's the Mecca for Black America. But in Atlanta, Georgia, majority white census tracts have 25.3 healthcare providers for every 10,000 people, which is almost 4 times greater than the 9.8 healthcare providers in majority Black census tracts. So if you're living in a community where there are no healthcare providers, for example, and we are placing COVID-19 testing sites in existing healthcare establishments, what does that mean? Well, it means what we've been seeing, that COVID testing sites are well sourced in predominantly white communities, but very sparsely located in communities of color. People of color, as Congresswoman Haaland just pointed out, are more likely to live in food deserts, water deserts, credit deserts, education deserts, employment deserts. And so racism and segregation are really driving these disparate outcomes. That is why dozens of national organizations have been working literally around the clock since the pandemic was declared to help fashion legislation that includes adequate resources to underserved groups, and to make sure that the resources that have been expended get to those areas that have been hardest hit by the crisis. The HEROES Act is a great example of that. The subsequent legislation that we saw around the Paycheck Protection Program is another example of that. The HEROES Act contains, you heard Congresswoman Haaland talk about many of the provisions that are contained in the law, but it also contains the kind of protections and guidelines that we need to help drive benefits to under-resourced and underserved areas. So you've got increased funding for health resources for communities that have been hit hardest by COVID-19. You've got transparency and data collection, right? Broken down by race, broken down by national origin, broken down by gender, broken down demographically, so we can see who is accessing the benefits and hold people accountable. The bill has been passed in the House, but in the Senate it's being blocked, quite frankly. And one of the reasons it's being blocked is because we do have these guidelines, we have these guideposts fashioned, built into the bill to ensure that more resources go to the areas that need the most, the communities that are hardest hit. So it's really incumbent upon all of us to pressure our senators, to push the Senate, to compel the Senate to pass the HEROES Act so that people can get the help that they need. If the HEROES Act does not pass, it will linger and worsen the impacts of the coronavirus. We will see an uptick in evictions, exacerbating homelessness and overcrowded housing conditions. We cannot have that. We had an evictions crisis prior to the pandemic. If the HEROES Act does not pass, it will just worsen that situation exponentially. So I'm going to stop there just in case there are any questions, but I really urge us all to put pressure on our senators to do the right thing.
Thank you so much, Lisa, and thank you for all you do and the National Fair Housing Alliance does on a regular basis, doggedly to address this issue and to bring it to the fore, and to put forward solutions. Let's see, in terms of questions, there was just, I think there's one here that asked if you could share the sources of the statistical basis for deserts for low-income people of color, and so forth, and in all of the communities where that's the case. If you could, I don't know if it's the kind of thing that you could either just let us know that it's on your website where to look, or if you have any comments about that, or something in the answer box, in the question and answer box.
Sure, I'll put some resources up in the chat box so that everybody can see that. But certainly go to our website, nationalfairhousing.org. If you click the resources tab, you'll see under reports, you'll see a number of, there are a bevy of reports that relate to disparities in the housing space. You can also Google, just type into Google, your Google search engine, inequality lingers and Trulia, and you will get links to some critically important research that the Zillow group did for the National Fair Housing Alliance that talks about how communities of color are under-resourced in 5 major different areas. So they looked at the environment, they looked at environment quality, they looked at the prevalence of mainstream credit providers, so healthy credit providers. They looked at healthy foods, they looked at healthcare, and then they also looked at the presence of what we call fringe or subprime lenders. These are non-traditional credit providers like payday lenders and check cashers. And so what they found in is community after community across the nation that, for example, good, healthy credit, healthy food resources, those kinds of resources are not located, they're sparsely located in communities of color, but they're well resourced in predominantly white neighborhoods. And then conversely, the high cost credit providers are sparsely located in white communities, but there are a plethora of those kinds of more abusive financial credit providers in predominantly Black communities. So I'll put a couple of resources up in the chat box.
Great, thank you so much for that. How do you feel in terms of the current moment that we're living in, and the increased attention to systemic racism? And every time there are conversations about that, I immediately think about what you just talked about, the decades of segregation and systemic racism in housing as being a key component of that. And of course, coronavirus is raising up the inequities in our system pretty starkly as well. How are you thinking about sort of leveraging this moment to address these longer term?
That's a great question. And I think that there are many opportunities. It's not just a result of COVID-19, it's also a result of the protests, the unrest that we're seeing in communities across the nation in response to abuses in the law enforcement sector. So those two things are highly connected, of course, and people are beginning to understand that connection and beginning to more understand why we need to address systemic and structural racism in America. So it is presenting lots of opportunities. For example, and I'm sure Diane is too, I'm being inundated. And when I say inundated, I mean literally, with calls from industry, the financial services industry in particular, from industry corporations asking what they can do. They realize they have not done enough. They realize that in many cases they're part of the problem. And so there are lots of opportunities that are opening up in terms of helping companies to understand what they can do to lessen inequality in America. But then we also have in communities across the nation, at the local level, we have local jurisdictions who are rethinking about how they police their communities, how they direct their public funds. So you've got communities who are now for the first time saying, you know, instead of spending money to militarize our police, maybe we'll take that money and put it into housing. Maybe we'll take that money and put it into healthcare. And this is really new, right? And I also think that this moment provides us a great opportunity for communities, particularly those operating in the healthcare space, to rethink their community health needs assessments, but also for jurisdictions to rethink their assessments of fair housing or their analyses of impediments to fair housing. You know, anytime you have a major event that happens in your community, and the COVID-19 pandemic and the unrest that we're seeing, these are major events. That is really all you need to justify reopening these two incredibly important documents and rethinking them and restructuring them so that you are driving more resources to areas that don't have the resources that they need. We are seeing examples of this in Columbus, Ohio. Columbus, Ohio just declared racism as a public health crisis. And I think that for the immediate right now, it's going to be local communities that are driving a lot of the changes that we need. But I think that there will be a federal response. I hope there will be a better federal response soon.
Thank you so much, Lisa. I really appreciate it. Phenomenal words, and appreciate your leadership at the National Fair Housing Alliance and for being such a great partner to the National Low-Income Housing Coalition. Thank you so much.
Thank you.
Okay, we're going to shift gears now and move on to one of our own here at the National Low-Income Housing Coalition, Ed Gramlich, who's going to give us an update on HUD funds. Ed? Ed, are you there? Calling Ed Gramlich. Okay, well, I think what we'll do is we'll come back to Ed. We may be having some technical difficulties here. And why don't we move on then to our field updates, and then we'll circle back to Ed when he's available to join us. So our first field update will come from Eric Samuels from the Texas Homeless Network. Eric, are you with us?
I'm here. Can you hear me?
I can. Go for it. Go for it.
All right. I know I don't have much time, and I could try to get through this quickly. Unfortunately, we don't talk too fast in Texas, so this might be difficult. Okay, so when I last gave an update about our response to coronavirus, we were still scrambling to respond in the most effective and productive way, and collaboration between our communities and our state was still a work in progress, but since then the situation has gotten better. Most of the communities that we've been working with have responded in very proactive ways. They've worked to decompress shelters, open quarantine shelters and units, and we've used FEMA non-congregate shelter funding in about 20 of our communities to do that. But most importantly, I think we've used funding to assist people just to move out of homelessness so that they can social distance just like anyone else, quarantine like anyone else. And a couple of examples, Houston is hoping to utilize around $56 million to house around 5,000 people over the next 2 years using this funding and some other privately sourced funding. Amarillo, they have closed all of their shelters except for the Salvation Army, and in that shelter they've reduced their capacity or their their average stay from about 180 people to around 65, which has allowed them to social distance folks. And but by doing that, they've done that through using home funds and other funds to move people directly into permanent housing. And they did this in mid-March and mid-April, or between that time. And most of these people have stayed in that housing. So that's really good news. Statewide, our homeless crisis response systems and my agency, we're working closely with the Texas Department of Housing and Community Affairs to best utilize emergency solution grant funding and CSBG CARES funding. Our agency is using that funding to provide TA to agencies that in many cases will be receiving far more funding than they've ever received in response to this crisis, this pandemic. A couple more things. We have worked with the Texas Hospital Association to establish a common discharge planning process across the state and identified representatives from each of the homeless crisis response systems that these hospital systems can contact when they're discharging someone who was experiencing homelessness. We've also worked closely with the managed care organizations, and they have stepped up to provide some funding. Thank you, Superior, to provide some funding for our relief and also masks. And through their donations, we've distributed around 10,000 masks. So this is encouraging, but we're really worried because yesterday Texas hit a record high in people hospitalized from COVID-19 for a single day. And unfortunately, the state keeps reopening and expanding how open businesses can get. So we're really worried about these numbers continuing to go up. And we've also seen and heard of a lot more evictions in process across the state. So we're just trying to remain vigilant and keep people housed and get people who aren't housed in housing. We know this is going to be a long road ahead, but we'll continue to fight. And that's my update.
All right, thank you very much, Eric. Appreciate that. We are seeing caseload in Texas increasing, so hopefully it will not continue to explode that way. Are you seeing? Has there been much testing of people who are experiencing homelessness or people who have been sort of concentrated? And if so, are there any alarming numbers, or it seems like it's under control?
We haven't seen testing, for example, what was done in Boston where everyone in shelters were tested. We haven't seen anything like that in Texas. In places like Houston, testing has been pretty available, and in Austin as well. But I don't know of any concerted effort to focus specifically on people experiencing homelessness and determine the proportion of people infected with COVID, either being symptomatic or asymptomatic. That's something we would like to see happen. I haven't seen that happen, unfortunately.
Okay, well, thank you very much, Eric. I really appreciate that report. We will move on to our next field update, and that's Shelly Nortz, Coalition for the Homeless out of New York. Shelly?
Hello, everybody. Thank you for inviting me to participate in this call this month. I think the last time you heard from my colleague, Josh Goldfein from the Legal Aid Society in New York City regarding what was going on in New York. So you heard about the early chaos in March. Just one note about the coalition. We are the original Coalition for the Homeless. We were founded in 1981, and pre-COVID, we're serving 3,500 homeless people a day through a dozen programs, and also operating as an advocacy organization, mostly in the city and state spheres. We're also the court-appointed monitor of the municipal shelter system in New York City. So we don't operate the shelters, we don't regulate them, but we do enforce court orders with respect to the access to shelter and shelter conditions. I would urge people to go to our website, coalitionforthehomeless.org, to find our COVID page, which has everything in the way of current city policy guidance on COVID-19 for shelters and outreach teams, et cetera. The product of some of that early chaos was to try to get some policy and practice down in writing so that people would know how to handle issues like isolation and screening, etc. Since the early days, New York has moved from having trouble just standing up isolation capacity, because of course we all were expecting there would be quarantine, to a situation where they've been concentrating on de-densifying the largest congregate shelters. Our system is segregated by population, so we have families largely in their own units, including both families with minor children and families that consist only of adults. But the single adult population of about 19,000 people at any point in time are sleeping in facilities that are principally dormitories. So the city has been, at our urging and not fast enough for our taste, helping people to move into double occupancy hotel rooms for the most part, starting with vulnerable populations, seniors, age over 70 and then over 65, people with health conditions that place them at risk for COVID, and then also moving entire shelters into hotels, as well as cutting the population and staffing in half at some congregate shelters with dorms and moving people into hotels from those spaces. They have about 11,000 people in hotels now, up from the 3,500 that were there pre-COVID, because we didn't have enough shelter capacity at all. And they plan to get to about 13,000 or 13,500. We think they should move everybody, but there's a kind of back and forth going on about whether or not providers and the city are willing to have people with psychiatric disabilities and addictions behind closed doors in hotels. We think that the risk is too great not to move them, but we will continue to have that argument with the city. The sad news is that more than 1,000 people in 200 shelters have become infected with COVID, and we've lost 93 people to the disease that we know of. We also know that there's excess mortality. So we have an age-adjusted mortality rate in New York City for people in shelters that exceeds that of the city generally and of every ethnic minority as well. I'm sorry, I heard someone speaking. I also want to just address the unsheltered population in New York who've been facing extraordinary odds before COVID, and now after COVID, it's even much worse. The hope count for the estimate of the number of people staying on the streets at the point in time in January has tended to be around 3,500. We know that's an underestimate, but that group of people now face a lack of access to food and clothing and showers because the places where they would get those things have closed down. Our own food program that serves now 1,100 people a night on the streets of Manhattan and the Bronx has seen a surge in demand from people who are desperately in need, many of them newly homeless, who were renting their rooms by the week and working either day labor or working in the many kitchens in small restaurants all over New York City. Move on to testing. They are testing now about 1,000 people a week in New York City shelters. We wish it were faster than that, but it has taken a long time to get that capacity up and running. The other thing that's happened to our clients is that they have closed the subways down from 1 a.m. to 5 a.m. every night for the last several weeks for extensive cleaning of the subways. Many unsheltered homeless people sleep in the subways, and this has created major problems for people, particularly those with disabilities, those with psychiatric disabilities who are having trouble understanding what's happening. Same for people with cognitive disabilities. And of course, when they're being asked to leave the subway, many are also people with mobility impairments who can't carry their wheelchair up the stairs to the street when they get kicked off the subway at the end of the line. These are ongoing disputes with the city over how they are policing homeless people. And I'm very glad for the people who spoke earlier about structural racism, because that clearly has affected the people who are homeless in New York City. It contributes to homelessness in the first case. It contributes to vulnerability to COVID. It contributes to their very unpleasant experiences in dealing with police. I think the things ahead for us are, we are very worried about what's going to happen with the remaining congregate shelters. We think that the COVID-19 pandemic has told us that we now live in an era of pandemic, and we can't really rely on congregate shelters as a way to handle homelessness. We need to get people into housing. The question is, when is the next pandemic? In the meantime, those that are left in congregate shelters, we're worried about cooling for the summer. Most of these shelters are not air conditioned, and fans obviously are capable of blowing the virus around. So we're really grateful to the National Low Income Housing Coalition for all of your advocacy on the emergency rental assistance, because we think that's going to be absolutely vital to keeping people in their homes and helping to get more people out of shelters, off the streets, and into housing. And I'll leave it there. Thank you.
Outstanding presentation there, Shelly. As I was jotting down questions I had for you, you proceeded to answer all of them. I was going to ask you about testing. I was going to ask you about infection rates. I was going to ask you about the subway situation, and you got to all of it. So thank you so much.
Thank
All
you.
right, we'll move on to our next speaker, Melina Lodge from the Housing Network of Rhode Island. Are you with us, Melina?
Hi, how are you?
Good.
That's a tough act to follow. I don't have nearly as many numbers. So Melina Lodge, I'm executive director of the Housing Network of Rhode Island. And I think, unfortunately, we're probably going to be mirroring what a lot of other states are seeing, in that we have an urgent need for rental assistance funds, utility assistance, not quite as much mortgage assistance as I would have projected. But certainly in those two categories, where we haven't, I think, been as successful as other states, is actually allocating CARES Act funding or other funds to address those needs. As of this moment, we have about $1.5 million of emergency rental assistance through the ESG program, which is exceedingly, we're not administering that program, but it's extremely difficult to make folks eligible. The guidelines are very tight. So we'd like to see leadership investing more flexible dollars into rental assistance with less restrictions that actually allows us to serve people. We are administering a few rental assistance programs ourselves. And I guess I would offer that I don't know as a collective if we've all been as thoughtful about how clients utilize the application and whether they're able to provide the level of documentation that we're requesting or meet the eligibility marks that they have to be eligible. So I do feel like while we're approving people, I'm actually denying people at a significantly higher rate. And I think monetarily, we probably need 50 to 60 times the amount of rental assistance. We're not also working on this either, but we've done some advocacy work around an eviction diversion program that the courts and the governor's office are considering. Again, I think the timing of the courts reopening with developing this program is a bit, building the plane as we're trying to fly it, because it's likely that we'll only discover what the shortfalls of the program are once we have people actually trying to utilize the program. And it's not clear yet what income targets would be, how that program would be attractive, since it's going to probably likely come out as a voluntary program and not a mandatory program. And I think for us within, the housing network and the Homes RI space, one of our larger challenges has been balancing sort of crisis advocacy work with advocating for our longer term housing needs. We actually had a pretty good package of housing tools on in the FY21 budget So how we're able to convince legislators to move forward on those in a time when we're experiencing extreme shortfalls on our state projected revenues, and we have, you know, an $800 million budget deficit, while we're also trying to protect the housing resources that are in our current budget. So sort of managing the now and crisis moment with the future, and we just know that it's going to get worse down the road, that there are still some protections for tenants through the moratoriums, for utility shutoff in the court system. Folks are also getting the extra $600 a week through unemployment. So there are some benefits, but we do know those are going to go away. And so the folks who have been teetering on the edge up until now will likely not have those securities in not that many months. So I think we're just concerned about having adequate resources and infrastructure in place to be able to tackle those challenges when they actually do hit. So that's it for Rhode Island.
Thank you, Melina. That was great. And you raised a really interesting and big challenge, which is that balancing of the short term versus long term when states are looking at these massive budget deficits going forward and trying to make decisions about what they're able to support when they really don't know how big their holes are going to be prior to getting more resources from the federal government, if that were to happen. So thank you for bringing that up.
Thank you for
Yeah, okay, and let's see, we'll now move on to our last field update, and that is from John Jopling from Mississippi Center for Justice. John, you there? Hello, John?
Hi, thank you, Paul. Can you hear me?
Yes, go for it.
It's really great to spend part of my afternoon with so many committed advocates, both within the National Low Income Housing Coalition and from other great organizations. I want to talk just a little bit about the eviction response that we are trying to present here at the Mississippi Center for Justice, as well as the policy advocacy. And I want to begin by acknowledging that our governor put a shelter-in-place proclamation into effect on April 3rd. And on that same day, we got a call from one of our state HUD leaders to tell us about a situation in a mobile home park in North Mississippi where a landlord was disconnecting all of the utilities to the people who lived in trailers who had not yet paid their rent. The human story behind the trailer park is that this part of Mississippi, which is right outside of Tupelo, Mississippi, is home to a lot of large furniture manufacturing plants. And these plants were unable to get the inventory and the parts that they needed from overseas, places like China and elsewhere, in order to continue their manufacturing concerns. So on or about, March 17th, they began to lay off their workforce. And so unable to pay their rent, these people attempted to negotiate with their landlord. They were unsuccessful, and the constructive evictions that were undertaken, in spite of the fact that a moratorium had been put in place, concerned even a public service commissioner who called us as well. So we filed and obtained a temporary restraining order in that county, Lee County, and the attendant publicity around that victory led to just an outpouring of phone calls that started on that weekend and have continued up until the present day. I need to point out that this crisis comes on top of the pre-coronavirus crisis in Mississippi, which includes a 2018 amendment to our Residential Landlord Tenant Act that permits immediate removal, same day, same afternoon, as you are determined to be behind in your rent and ordered evicted, you now have to leave that same day. You can't imagine what this means to a family who doesn't have the usual cushion. In years past, it's always been at least 10 days in which to locate and a new place to stay and then relocate their family to that new place to stay. The other bad new law is a change in our landlord lien, which is an outgrowth of the sharecropping system that in the old days allowed the owner of the farm or the plantation to keep a lien on all of the work tools of the sharecroppers. So if the sharecroppers hadn't paid their debt to the company store, as it were, the owner could seize their hoe, their shovel, all of the implements of their trade so that they would not be able to leave the farm and find new employment or start over anywhere else, but would remain indebted to the ownership class, which continues to this day in the form of a law that now allows that lien to attach automatically and allows the goods to be seized also on the same day. So the hardship has been significant for decades. And in this state, there's only one legal aid lawyer for every 20,000 eligible residents of the state of Mississippi. So for these people to now be calling our organization is quite an additional burden on our ordinary work that we do here at the Center for Justice. So what we've been seeing are two basic scenarios. One, the landlord has verbally threatened an eviction or has in fact served a written notice to quit upon the tenant who is delinquent. And two, or else the landlord has taken certain affirmative steps that would constitute a constructive eviction. And this is in spite of the moratorium, which has now been lifted as of June 1st, but I'm describing what was happening in April and May. So even though evictions were not permitted to go forward, landlords were either disconnecting the utilities to units occupied by a tenant whose employment had been interrupted by the coronavirus, or they were, in some cases, locking the tenant out of their unit. It's been very difficult to serve 82 counties from a location, in my case, that's on the Gulf Coast. So a lot of our work involved making sure that people had copies of the moratorium, the governor's proclamation, that they were able to show their landlord that in fact there was a prohibition on evictions at that point. We also provided people with basic coaching in terms of how to negotiate with their landlord when they were behind in their rent. And in some cases, we negotiated, of course, had to, in some cases, negotiate directly with the landlords. I think that the ray of hope here is in the emergency rental assistance area. And I think it takes us to a better way of responding to the crisis in rental housing that we wouldn't have arrived at as early without the situation that we're in. And so we look to the National Low Income Housing Coalition for leadership in terms of emergency solutions grant and CDBG funds and other sources that could serve. And we're in contact with our state housing finance agency, particularly on the issue of programming out the ESG funds. We don't see the situation improving anytime soon, and I do want to point out the extent to which it has been exacerbated by delays in the state's processing of unemployment claims. Many of the people who lost their jobs on March 17th have still not completely processed their unemployment claim or received any money. Some of them are in various steps and some of them have claims pending. But believe it or not, people almost 3 full months later have still not received their state unemployment, which is necessary in order to trigger the additional federal add-on. So I think my time is up, so I'll just stop with that.
Thank you, John. Thank you for a, quite honestly, very sobering report out. And thank you to the Mississippi Center for Justice for all you're trying to do while feeling completely overwhelmed.
Thank you.
And yes, emergency rental assistance is obviously direly needed. Thank you very much for that. Let me just check in. We'll be moving on now to our next presenter. Let me just check in to see if Ed Gramlich has, if we figured out our technical problems.
Paul, can you hear me?
I can. It's so great.
Yay. Well,
All right.
I got a bum Zoom link, and so I'm now on my my smartphone. So let me know if I fade out or something, or if I need to yell what I'm saying.
Okay, great. Take it away on updates on HUD funding, Ed.
Not only funding, but also policy guidance.
Okay.
So the CARES Act provided up to $5 billion in community development block grant or CDBG supplemental funding. Of that amount, the first round allocations of $2 billion were announced on April 1st. A second round of $1 billion was allocated to states on May 11th using a new formula created by HUD that was based on public health needs and economic market conditions. So that leaves $2 billion. That remaining $2 billion is to be distributed directly to a state or local government at HUD's discretion using a formula that prioritizes the risk of coronavirus and economic and housing market conditions. Now, those allocations can be made on a rolling basis instead of all at once like the first two rounds of funding. Given all that money, to date, HUD's Office of Community Planning and Development, or CPD, has yet to provide any substantive guidance regarding how states and local jurisdictions can actually use these funds. Consequently, many jurisdictions hesitated to move forward on activities that could have helped address pandemic-related needs. However, on June 8th, the Office of Management and Budget, or OMB, received for its review something called the CDBG-CV COVID-19 fact sheet. So we should be seeing some form of guidance soon. It did not exist as of the start of this Zoominar. The CARES Act also provided $4 billion in Emergency Solutions Grant, or ESG supplemental funding. Of that $4 billion, up to $2 billion was to be distributed using the same formula used to distribute the regular annual FY20 ESG allocations. CPD announced allocations for only $1 billion out of that $2 billion on April 1st. The CARES Act requires that the remaining $3 billion to be allocated directly to a state or local government by a special formula to be developed by HUD. And then on June 9th, CPD did announce the allocation of $2.96 billion of extra CDBG's CV funding. Now, although there hasn't been any guidance for the CDBG program, CPD did issue sets of waivers on April 1st and May 22nd for ESG, the continuum of care, and the housing opportunities for persons with AIDS or HOPWA programs. Separately, CPD also issued Notice CPD-20-5, providing guidance on implementing the CARES Act provisions for the $65 million supplemental funding appropriated for HOPWA. Now, although there are no CARES Act provisions for the home program, CPD issued 2 sets of waivers via memoranda. One set is designed to make it easier for home participating jurisdictions to use HOME's option to create a tenant-based rental assistance program, or TBRA. The other set of waivers is aimed at addressing immediate housing needs and preventing the spread of the coronavirus. Moving away from CPD, let's take a look at HUD's Office of Public and Indian Housing, or PIH, which administers the public housing and voucher programs. It has been providing frequently asked questions, or FAQs, since way back on March 13th. The latest is the 4th version dated May 29, and it contains 43 pages of FAQs. PIH also published Notice PIH 2020-5. It has a broad set of waivers, over 30 pages for the public housing and voucher programs alone, not to mention many more pages that are devoted to the Indian Housing Block Grant Program. The CARES Act appropriated $685 million supplemental funding for the Public Housing Operating Fund. Notice PIH 2020-7 implements those provisions of the Act. The CARES Act appropriated $1.25 billion supplemental funding for the Housing Choice Voucher Program. Of that $1.25 billion, $850 million was set aside for additional voucher administrative fee funding. Notice PIH 2020-8 addresses implementing $380 million out of that $850 million set aside. Moving over to HUD's Office of Multifamily Housing Programs, or multifamily as it's known, it administers the Section 8 Project-Based Rental Assistance Program. Multifamily has been providing so-called Q&As since March 16th. The latest is the sixth version, dated May 21st, containing 49 pages of questions and answers. NLIC and other advocates have been conveying to PIH and multifamily some concerns that we have with PIH's existing waivers and multifamily's Q&As. That's because the waivers are only optional and the Q&As are not requirements either. Let me give you one example of a problem area that illustrates this. It pertains to interim income recertifications in the PIH and multifamily programs. So normally when a resident experiences reduced income or even a loss of employment, as is happening clearly now in the current pandemic, both PIH and multifamily have existing provisions for interim income recertifications. Both the PIH waiver and the multifamily Q&A still require a resident to request an interim income recertification in order to trigger the process for actually reviewing the request. However, a lot of residents might not even know about their right to request an interim recertification, or might not actually be able to quickly make the request in the midst of this pandemic. NLIC and others have provided really detailed suggestions regarding how the PIH waiver and the multifamily Q&A ought to be revised in order to meet adequately meet the needs of residents during this pandemic. And that's just one example. And that's kind of my quick overview, a superficial overview of a lot of what's been happening, both in terms of funding and HUD policy. And I'll turn it back over to you, Paul.
Okay, thank you, Ed. We don't have any questions yet, so keep your eye on the Q&A and chat, and if there are any, then you can respond to them there, okay?
There's a lot, I can only, cover the surface. Some of the most important details have been written about in memo to members, so that's another area that you can explore if you have some questions.
There is a question that just came in asking you, did you say that HUD is drafting CDBG CV guidance?
They've been saying that since middle to end of April, and they say that every week. I'm guessing that document that's over at OMB, that fact sheet, I'm guessing that is it. And I keep expecting it out any minute now. I've been looking at the websites every 10 minutes today, but I got nothing to report to you today. I bet you it'll come out this week, and I will be writing about it in memo.
So there's good advice. Please, if you are not currently registered to receive NLIC's memo to members and partners, it comes out every Monday. It's an e-newsletter. Be sure to do that because Ed provides updates every week. Thank you very much, Ed.
Thank you.
We are now going to shift over to Lisa Marlowe, who's also at the National Low Income Housing Coalition on our communications team, who's going to talk a little bit about communicating the need for emergency rental assistance. Lisa?
Hi, thanks, Paul. Hi, everyone. As Paul mentioned, my name is Lisa. I'm the Manager of Media Relations and Communications at the Coalition. And today I just wanted to share with you some of the ways NLIC has been communicating the need for emergency rental assistance with policymakers, our partners, and the media. So I want to start out by emphasizing one word: share, share, and share some more. Well, technically that's 4 words, but you guys get the point. In order to be successful with any campaign, you must share resources, information, stories with everyone, from policymakers to partners to your high school sweetheart, everyone. You should share using different platforms and share it beyond your personal bubble. Even if you think you're screaming into the wind, that scream will reach at least one other person who could potentially be the key to moving the needle toward success. On the June 2nd National Call on Coronavirus, Housing, and Homelessness, House Speaker Nancy Pelosi said, "Local media is very important. I would encourage any visibility to get press on the fact that people really probably don't know that the HEROES Act has rental assistance in it." And in the following week, Senate Minority Leader Chuck Schumer said on that call, "So we have to pass this bill now, and I'm asking all of you to join us. But basically, we can't afford to wait." Ultimately, they were both calling on us to help increase the visibility of the housing provisions and resources in the HEROES Act, and to express the urgency of including these resources in the next relief bill. So what are some of the tactics NLIC has used to communicate the need for emergency rental assistance? Well, we've used a lot. In addition to these national calls, working group calls held every week, and updates in our weekly e-newsletter, Memo to Members and Partners, that Paul just mentioned. We've also shared e-blasts with our network that includes a combination of information from encouraging people to participate in tweet storms to giving people information about the HEROES Act when it passed the House. We also send emails every other day to our Disaster Housing Recovery Coalition members and partners, sharing the day's events, action items, and other national updates and state and local news as it relates to coronavirus. We've also worked closely with the media and given our state partners the tools to share information with the media. In the last month, there has been more than 400 articles written about rental assistance. Our partners have submitted op-eds and letters to the editors on the need for emergency rental assistance. Our friends at Results shared on a May 26th national call that there have been over 84 LTEs and op-eds published this year on rental assistance and the need for housing provisions and resources. Our state partners in Utah, Massachusetts, and Colorado have recently published op-eds and LTEs on the subject. We've also used social media. Hopefully everyone has watched the We Need Rent Relief Now short video that has been viewed almost 900 times on Facebook and more than 2,500 times on Twitter. It's a compilation video of more than 15 partners calling for rent relief now. It includes clips from many of our state partners and some champions on the Hill, Senators Sherrod Brown, Bob Casey, and Representatives Denny Heck and Lori Trahan. If you haven't already watched this video, please do, and repost to your social media platforms. It specifically references June 1 rent, but we all know July rent will be due in just a few short weeks, and we want members of Congress to keep the fact that millions of people are out of work and can't pay rent as an urgent matter and at the top of their minds. As Minority Leader Schumer said, we can't afford to wait. So to help everyone spread that message, we've launched the Can't Wait social media phase of this call to action. We've added a social media toolkit to the coronavirus website page that provides blank posters that you can download and write in what can't wait for housing stability. It also includes pre-filled posters that say things like, my family's health can't wait, my safety can't wait, my children can't wait. You can share these images on social media and tag your member of Congress who has so far yet to champion publicly housing provisions and resources in the next relief package. We've created frames for your Twitter and Facebook profile pictures and header, and we've even created cool t-shirts that you can buy and show your support in real life. We've also uploaded our full media toolkit that includes sample social media posts, images, and a sample op-ed that you can customize with state and local information. So check it out, share it, and use it wisely. So I wanted to close today by saying thank you. On your screen, you should see an early list of co-sponsors of the Emergency Rental Assistance and Rental Market Stabilization Act. This, of course, was a very impressive list. But because of your support, we've now grown to 39 Senate and 155 House co-sponsors of this bill. So thank you. Thank you to everyone who has sent a tweet, wrote an op-ed, or sent an email to their members of Congress. It's working, but we have to continue the drumbeat and keep our eyes on the ball to help us reach success. So please continue to move the needle. And now you have even more tools in your toolbox to help do so. Paul, I'm going to turn it back over to you.
Thank you, Lisa. Thank you for all your great work. And I just do encourage everyone on the call, please use that social media, the media toolkit that Lisa talked about, all that social media that's been developed. Get the word out to local media. As she mentioned, Representative Pelosi said there's nothing more important than that local media. So please do what you can. Okay, we're going to now talk about next steps and needed advocacy, and I'm going to turn it over to Kim Johnson from the National Low Income Housing Coalition. Kim?
Hi, thanks, Paul. Hi, everyone. My name is Kim Johnson, and I'm a policy analyst here at the Coalition. So first, I have a couple updates to share on the next coronavirus relief package. Over the weekend, the White House stated that they would be pushing for at least $2 trillion in additional aid in the next package. This suggestion is seen by some as an attempt to find a middle ground between House Democrats, who passed the $3.5 trillion HEROES Act, and congressional Republicans who, under the leadership of Mitch McConnell, have vowed not to spend, quote, a penny over $1 trillion in the next package. The White House has also stated they'll be pushing for a payroll tax cut to be included in the next relief package, which is a proposal that has not been met with a warm reception from members of Congress. The timeline for the next bill looks largely the same as it has been. We're expecting Democrats and Republicans to sit down at the table together and begin negotiations in the last 2 weeks of July. So there's still some time to build more support for our asks. Like Lisa said, we're currently up to 155 co-sponsors in the House and 39 co-sponsors in the Senate on the Emergency Rental Assistance and Rental Market Stabilization Act, which is HR 6820 or S 3685. Last week, Senator Shaheen from New Hampshire and Representatives Castor in Florida and Houlihan in Pennsylvania signed on as co-sponsors. So thank you to all of our wonderful advocates who have been putting pressure on their members of Congress to join on. Like Lisa said, it is working, so that's exciting. We are still trying to push our remaining Democratic senators to join, and that list includes Senator Cantwell in Washington, Harper in Delaware, Warner in Virginia, Tester in Montana, Manchin in West Virginia, Jones in Alabama, and Sinema in Arizona. So if you're in any of those states, please keep calling and emailing your senators to get them to sign on to the Emergency Rental Assistance and Rental Market Stabilization Act. That'll just about do it for me. Thanks to everyone for joining us today. And now I'll hand it back over to you, Paul.
All right, thank you, Kim. And we'll transition very quickly to Joey Lindstrom, who will talk a little bit about needed advocacy in the field. Joey.
Thanks, Paul. And I know we're running short on time, and I'll be brief. And I really want to just put a thumbs up to everything Lisa was saying earlier on making sure that we're consistently sharing our message and using the hashtag #RentReliefNow. That's so important. Remember that we're doing this not just to influence those members of Congress who haven't yet co-sponsored the Emergency Rental Assistance and Rental Market Stabilization Act, but also to thank the ones who are on board, both for that bill and other housing elements within the HEROES Act. It's so important right now to be saying thank you to those who are our supporters, because when when they feel that their leadership is being noticed, they are more likely to become our champions. So I continue to push that particular approach. We have seen a lot of growth on our 2 sign-on letters over the last week. And our organizational sign-on letter specific to rental assistance was entered into the congressional record last week by Representative Denny Heck. There's a really cool video of that we can share with you as well. And then finally, I really want to thank everyone on this call who participated in our work groups last week, and some of you who were even on our state partner call. We had a lot of really good conversations about our messaging around coronavirus in this moment when so many people are focusing rightly on the need for police reform and a focus on racial justice and so forth. What we've learned from our field and from congressional offices that we've been engaging with is that now really feels like a moment for action, and that people on the Hill really understand that housing justice and racial justice are very well linked. So we as always want to highlight the ways that racial justice and housing justice intersect, but we find that it's been a good moment to continue to push for our agenda of major investments in housing resources for low-income people. So please continue to promote our sign-on letter, which you can find on our COVID-19 page on the website by clicking on the Take Action button. The sign-on letters are really important, but we also encourage you to share with your networks the email template that people can use to send emails very easily to their members of Congress. As Senator Schumer indicated last week when he was on our call, that if every Republican who's waffling on the HEROES Act got 25,000 emails, they certainly would become supporters. And I believe that's quite true. It looks like Brooke has shared in the chat box the link to the organizational sign-on letters. And that same Take Action page should bring you to the email template. So thanks everyone for your ongoing advocacy. We know that's what's building our momentum and carrying these asks forward. Please be in touch with me or anyone else on the field team if you have any questions.
Okay, thank you, Joey. And someone in our audience was asking about the next Tenant Talk Live, which are all focused on coronavirus, housing, and homelessness. And here to talk briefly about that is Renee Willis from the National Low Income Housing Coalition. Renee?
Yeah, hey, great. Thank you so very much, Paul. So perfect timing for that question. So yes, we're having, again, my name is Renee Willis. I'm with the coalition, and I'm on both the field and the communications teams. And so Tenant Talk Live, the next edition of Tenant Talk Live is Monday, June the 22nd at 6 p.m. Eastern Time. And Tenant Talk Live, it is a call/webinar that provides opportunities for residents to connect with the coalition and to connect with one another. Also an opportunity for residents to share best practices and learn how to be more involved in influencing federal housing policies as they lead in their community. So on our next call on June the 22nd, we really want to leave space, given all that's happening in the country. We want to have space and time for residents to talk about what's happening in their communities. But also too, we have special guests who will be joining us. The topic, I should say, is race, housing, and hope. And our guests are Vanessa German, who is an artist and social activist in Pittsburgh. Vanessa, she has numerous collections in permanent collections, and her work has been featured in NPR, the New York Times, and other outlets. But what Vanessa does is she really uses her art to address hate in the world and while expressing hope for the future. So Vanessa will be joining us on the 22nd. We also have Rashida Phillips, who is a senior advocate of resources and training, and she's an attorney at the Shriver Center. Although I know that Rashida is transitioning, she will be, I think, moving to Community Legal Services of Philadelphia. But Rashida does a lot of work around economic and racial justice. So we're really, really excited to have Rashida on the call on June the 22nd. So we hope that you all can join us, and please do, if you can share this out in your networks, especially, we want to get as many residents and tenants on this call as possible. So if you could share in your networks, that would be fantastic. And I think that's it. So again, the next call is Monday, June the 22nd at 6 p.m. Eastern Time. And you can find a link to the registration page for this webinar. You can find a link on our website. If you go into the COVID-19, on the COVID-19 page, you'll find a link to the Tenant Talk webinar. Thanks so much. And Paul, I will turn it back to you.
Okay, thanks, Renee. So in addition to Tenant Talk Live, we have several other working groups, so smaller calls that get more into the nitty-gritty about all this stuff. There's a legislative working group that takes place on Tuesdays at 12:30 Eastern Time. There's a Working with FEMA working group Tuesdays at 3 p.m. And then there's a state and local implementation working group Wednesdays at 3 p.m. You can find information about all of those and join those calls on our website. Just click on the COVID-19 page. It's right on the main page of our website. So that concludes our call for today. Thank you very much for participating, and keep up the good work and keep up the advocacy. Thank you so much. Bye-bye.